You know, right now, high costs are forcing many patients out there to ration their life-saving medications.
It's a dangerous practice, and tonight our team is investigating the deadly consequences.
I was at my desk at work, and it was on a Tuesday. I definitely didn't think my baby was dead. And my son rolled her over. And she had an insulin pen in her bed. It was empty. And then all of a sudden, I now have to watch what I eat. I have to count my carbs. You know, I have to inject myself with insulin. I have to prick my finger to check my sugar. They paid for all of her diabetes supplies, her care, everything, up until the age of 21.
How old was she when she passed?
22.
Bob in Minnesota and Diane in Wisconsin and so many countless others, they can't afford or they don't want to have the responsibility of financially bankrupting their family with that more than $6,000 out-of-pocket cost a year. They're skipping doses, they're prolonging refills, all of those things to try and stretch it out more. You're not getting the full efficacy of the medication and you're putting yourself at risk.
The 1920s, when Banting and Best isolated insulin, they sold the patent to the University of Toronto for $1 for the express purpose to make this an affordable disease. There are 3 insulin manufacturers in the United States: Eli Lilly, Sanofi, Aventis, and Novo Nordisk. They have the entire market. And now we have a situation where Eli Lilly releases Humalog in 1998 for $21 a vial, and it's now $300 a vial.
She went to the pharmacy and she was like, "Mama, they want $500 for my insulin." I was like, $500? I said, "What?" I didn't know how important it was for her to really have that insulin to live. I miss my baby so much. Goodness gracious. I try not to get emotional because I just miss her so much.
In a statement to 11 Alive, Eli Lilly says anyone is eligible to purchase their insulin prescription for $35 or less per month. They also say despite rising deductibles, the average monthly out-of-pocket cost for Lilly insulin has dropped by 44% over the last 4 years. You can read their full statement and watch our entire investigation on the cost of care on our website, 11alive.com.